Good evening, and welcome to tonight's lectures. We're going to be talking about cosmetic surgery. We have renamed the event In Your Face, and we are very pleased with both of our speakers tonight. They're both experts in their field. I will say, just as a general Spiritgrow introduction, we like to have events talking about health and well-being, talking about spirituality, talking about questions and consideration to identity issues. And the topic tonight relates to many of these. There's the health element, the spiritual element, the consideration of personal identity, and therefore it's very much something that Spiritgrow would like to be part of, and something a discussion that Spiritgrow would like to have with the community. Now, the first speaker, Dr. Allan Kalus, who is, as I said to him right before we started, he is the type of expert who knows this off the tip of his fingers. He's been practicing for, is it 35 years? Mm-hmm. 35 years with 35,000 procedures. Mm-hmm. Wow. So when he walks down the street in Melbourne, he's like, yep, no, yep. He's very qualified. We sent a longer, a more detailed bio today, but if very well regarded place, a very well regarded clinic for plastic surgery is the Avenue. What's the full name? The Avenue Plastic Surgery. Quite simple. I do, and Dr. Allan is the founder and the lead surgeon there. I welcome everyone here. I'll just mention, since we have someone here who will be presenting later this week, that Kobe Aved is running our Spirit Sing, which is the sing-along for the weeks coming towards the high holidays, and he's here and we thank him. We also welcome other professionals in the industry who are here, and we welcome, and all our guests. Although we don't have guests here, everyone is, of course, welcome, and everyone's part of it. Dr. Allan Kalus, thank you.
Thank you very much. I've got a headphone. Thank you. So thank you, and what a great privilege and honor it is to be here tonight to speak to you all. And just looking around the room, I'm so happy to see so many former and future patients of mine. Rabbi Glassman is recovering very well after his gender reassignment operation. But we've got lots to talk about today, and so I'm going to move fairly quickly, and I think it would be appropriate to have questions maybe at the end. So as you've heard, my name is Allan Kalus. I'm a plastic surgeon. I practice in the Avenue in Windsor, and we have our own day surgery and plastic surgery clinic, which we've had in this location about 25 years. And of course, plastic surgery comprises many aspects. There's the reconstructive component, and everyone will understand the need to reconstruct patients after injury or children with cleft lips and cleft palates. But what about aesthetic surgery or cosmetic surgery, which is what I've been asked to speak about today? Well, it's really a branch of plastic surgery, and personally I don't like the word cosmetic surgery because I think it devalues what we do. I think it refers to something that's trivial and temporary. I much prefer the word aesthetic surgery, and to find a definition of aesthetic surgery, we can go back to 1598 when an Italian by the name of Gaspare Tagliozzi, and it's interesting that they were doing aesthetic surgery at that time because people used to have their noses amputated as a punishment for thieving, and so a very popular operation at that time was to reconstruct the amputated nose, and he was one of the experts at that operation. And I'd just like to read this because it's such a beautifully expressed definition. So as aesthetic surgeons, we restore, rebuild, and make whole those parts which nature has given, but which fortune has taken away. Not so much that it might delight the eye, but it might buoy up the spirit and help the mind of the afflicted. So this really is the raison d'etre behind aesthetic surgery. And people who are not really knowledgeable about the subject believe that people who have cosmetic operations, cosmetic surgery, do so out of reasons of vanity. But this is very rarely the case. Most often people undergo surgery because they've been worried and stressed and anxious about something for a very long period of time. And the aim of aesthetic surgery is as much to buoy up their spirit, to make them feel normal. And I think the essential mark of a good aesthetic surgeon is that we should aim for normality. We don't aim for supernormality. We don't want to give someone super good looks. So we want them, as the patient wants, they want to look normal. And I'm only going to today touch on a few procedures that we do, but I hope it'll give you some idea of the scope and the breadth of aesthetic surgery. So it often starts off with a young child, age 7. They go to school, they have prominent ears, and they get teased at school. They may present with school refusal. And parents bring their child along saying, look, my boy is crying, he's unhappy at school, what should we do? Well, the options are you could try psychotherapy for many months, probably won't work, or you could set back the ears. It's a simple operation. If done properly, it's very effective. And it's interesting, these children come along and it must be a terrifying experience for them to go into an operating theatre and with the lights and so on and see the surgeon, and yet they willingly come along because they want to look normal. And this is one example of aesthetic surgery and how it works. The nose is the central part of the face, and it said, and Leonardo da Vinci actually said that the nose sets the character of the face. It is no wonder then that so much of our work centres around the nose and people's self-consciousness about the nose. And so much has appeared in the media about the nose. And the 5 noses here it says that everyone wants, and they list all these famous noses. I particularly like the one down here of the Concorde. I think that's an attractive nose. But it's interesting, it's rare that someone comes along and says, I want a nose like Kylie Minogue. They usually come along with, a very complex anxiety disorder. I mean, this girl, her nose not only dominates her face, her nose actually has dominated her life. And she was a recluse. She didn't go out at all. She was just so embarrassed about her nose. And like most people who present for rhinoplasty, she was teased about her nose on many occasions. And if you look at her, her nose is long and twisted and has a bump and a large tip. And so looking at a girl like this, I say to them, this operation is not about changing your nose, it's about changing your life. I can fix your nose, but the rest is up to you. Well, once we do this, you have to overcome all your anxieties and fears. And it's another stage of the recovery. And so this is her after the operation. And it's just such a rewarding operation and such a privilege to be able to help people like this. And in fact, this girl went along and she came to see me many years later, married with a child. And I thought that for a recluse, that was a pretty good outcome of surgery. And this is the sort of outcome that we aim for. In fact, Rabbi Glassman, another rabbi once said to me that, whereas rabbis fix people on the inside, as a plastic surgeon, I fix people on the outside. But I think we're both always working for the inside because it's much more important. So this girl came along one day and she was engaged to be married and she was dreading her wedding because she hated the appearance of her nose. And her wedding was in about 2 months' time. And her mother was there. And I said to her mother, look, she just hated she was dreading her photo being taken at her wedding. So I said to her mum, simple, just write on the invitation, no photos allowed. Yes, that's her mother laughed, just like that. So anyway, so we decided to do a rhinoplasty for her, and that was her result. And so she was able to go ahead and get married, and photos were taken, and looking at her front view, you can see it was quite a radical change to her nose. But interestingly, before the operation, she wore very bright lipstick and lots of eye makeup. She was overcompensating for her nose, and people often do this. And with plastic surgery, we're able to change it in this way. Now, this lady came to me, and you see she had a bump on her nose and also a rather prominent chin. And she came along with the story that she had a little 7-year-old boy whom she was taking to school. And one day the boy came home and said, "Mummy," he said, "one of my friends asked me whether my mummy is a what? A witch." That's right. And I said to her, "Madam," I said, "is it absolutely necessary that you take your little boy to school every day on that broomstick? And do you have to wear that big black coat with a pointy hat with the moon on the front?" Anyway, so we did a rhinoplasty for her as well. And you see, by removing the bump on her nose, she looks a lot better. And I'm pleased to report that she sold her broomstick. I wished I'd bought it. She put it on eBay, and she bought herself a little Corolla, and all was well. And rhinoplasty these days, just to tell you what it involves, the operation takes about an hour, and we actually do it as a day case. People go home after 3 or 4 hours. They have to wear a little plaster for a week. It's not painful. I don't know how I can explain to people that it's not painful, so I have this photograph I showed patients of I'm sorry, I've turned this off now, of the, how do I go back here? I have where's my man? I've pressed the wrong button. I'll go back to the start. Okay, I'll keep going. Not many buttons. I have a picture of the patients with reading a Who magazine, and you don't have to read Who magazine, of course, but it's at least 2 hours after the operation you're able to read and able to go home quite quickly. Now, I thought I'd talk a little about facial aging. And I know that we could talk about fillers and Botox, but I want to talk a little bit about the surgery of aging. And of course, aging is a continuum. And you might all like to think, where are you? Where are we in this process? And what actually happens as we age, this has been much studied. There's a loss of elasticity of the skin and also a loss of fat. Sometimes people come along with a simple problem, that they are aware of the excess skin on the eyelids, which often is very heavy and it limits their vision. And so it's quite a simple procedure to remove the excess skin and brighten up their eyelids. Sometimes even in a young person, you can have rather prominent fat bags under the eyes. And again, done from the inside of the lid, just removing the fat bags makes them look normal. And once again, they never present just because the fat bags are there. They come because they're embarrassed. Someone has said, "You look tired." Like this gentleman. He said that people said he looked tired all the time because of the bags under his eyes and the excess skin in his upper lids. And of course, by removing that all, he doesn't look tired. He looks a bit more invigorated and a bit alive and a lot happier. And of course, as well as the sagging of skin and so on, there's this volume loss with aging. And we see this if we compare a mother and daughter. And occasionally I have the pleasure of seeing a mother and daughter together, and I often sit them together like this and take photos. And you can see the difference. There's a real loss of volume to the skin between the daughter and the mother. So a lot of the focus now in our surgery for aging is to replace that volume. And the best way is to use the patient's own fat. And I'll just be speaking a bit more about fat later on. But this is the sort of result that we can achieve now. And why does a lady like this come along to have facial rejuvenation? I mean, she looks quite okay. She was 55 years old. But the problem was that she found herself, at the age of 55, suddenly divorced, on the market, looking for a new partner, and wanting to look her best. And so by doing her eyelids and putting some fat into her lips and her nasolabial grooves and her cheeks, we can really make quite a transformation and hopefully give her the confidence that is required to go out again and start dating again and meeting people. An elderly lady comes along for a neck lift. Well, it's quite straightforward to tighten the skin of her neck, and that procedure is done regularly. But if I had done that to her neck and left her lips looking like this, it would have been a total giveaway of her age. So good plastic surgery is all about balance. And in this situation, we really have to augment her lips, again with a little bit of fat, to try and give her that attractive look, make her lips look commensurate with the rest of her face. A lady in her early 50s coming along, lovely quality skin, a pleasure to work with skin of this quality. We can tighten the skin, but adding fat to the lips, we're not aiming for large lips. I don't want to produce a caricature of a woman. I just want to give her a little bit of turgor, fill in the nasolabial grooves, highlight her cheeks a bit. And this is the sort of result that we can achieve using a combination of skin tightening and facial fat transfer. And again, once there's more aging, the fat transfer becomes even more important. And putting the fat into the lips gives that not a large lip, but turgor in the lips, which makes it look so good. And again, another lady showing the effect of the fat, especially in the cheeks. Of course, older ladies with lots of wrinkles, still a very effective rejuvenation by tightening the skin and adding fat as well. So I could spend a long time talking about facial rejuvenation, but I just want to move along quickly because there's just so much to discuss. Now, breast reduction surgery. When I was asked to give this talk by Rabbi Glassman yesterday, I thought so much of our work revolves around the breasts, and I thought, well, could I show any photos of breasts? And he said that halakhically, if it was for medical purposes, that would be fine. But I'm sorry to say, Rabbi, that when I mentioned this to my wife, she says no. You were overruled, as I'm sure you are regularly by the Rebbitzin. And so no pictures of breasts tonight. I'm sorry, gentlemen. But when we talk about large breasts, inevitably there's a physical problem. There's neck ache, there's backache, and the first thing I examine is the spine. And look at this curvature of the spine. And look at this lady in her 70s, the curvature. And if you do an X-ray, you see multiple vertebral fractures. So the constant weight of the breast has caused the spine to collapse. And people report that they can't buy clothes that fit. They always wear loose clothes to hide their bust. They can't exercise. They can't run. Hard to turn over in bed. There are just so many physical symptoms, as well as the psychological symptoms of feeling embarrassed and unwanted attention that some of the younger women suffer. So, and also you can see something else, that this shoulder groove that occurs due to the brass straps. So after a breast reduction, you can see that the spine actually, in a younger woman at least, will straighten. And we even do a bit of fat transfer to the shoulder grooves, and in that way we can correct the shoulder grooves, which otherwise would not be self-correcting. Now, the tummy. So why is the tummy a cause of concern to some people? Well, in this case, a young woman had twins. And as beautiful as her twins were, this devastated her figure. You can see even after twins, she still wore a two-piece swimsuit, but she felt she just couldn't show her tummy in public. And with a tummy tuck operation, we actually remove all of this lower skin and fat, and we stretch the skin down and stitch this point down to here and end up with a nice flat tummy. A long scar which can be hidden in the panty line, which usually disappears. But really a very nice flat tummy. And or we operate on someone like this who had what's called a lap band procedure and had a massive weight loss of 35 kilograms. And unfortunately, for some patients, or for many patients, they go through this massive weight loss and they find themselves still looking ugly afterwards with all this excess skin. So again, we can remove all the skin and tighten the muscle and improve the waistline and these days we do this operation often as a day case, with patients going home the same day. And from the side view, you can see also the rejuvenation of the tummy. This man lost 55 kilos. So it's not just women who have plastic surgery. And of course, look at this woman with this huge apron that made it hard for her to dress and hard for her to get around. All that can be removed and give her a normal tummy. So we're really aiming for normal tummies. And what about this? This lady has what's called a ventral hernia. The muscles have spread apart so much that the bowel is all protruding forward. So again, we can stitch the muscles up and really reconstruct the whole abdomen. And this is all part of plastic surgery. Is it aesthetic surgery? I suppose it is aesthetic surgery, but it's really reconstructive as well. But it's always to uplift the soul, which is very similar to what Spiritgrow is all about, when you think about it. But what about this? A lady with a small tummy, small excess. Is this more cosmetic, more aesthetic? Well, plastic surgery is real surgery. It has real complications. There's an anesthetic. There's a recovery. So no one enters into aesthetic surgery lightly. And every person has their own individual reasons why they want to have the surgery. And I always inquire, and I always say that the operation is designed not just to fix the tummy or the body part, but to make them feel better about themselves. Now, breast augmentation obviously is a very large field for any plastic surgeon. And, breast implants have been around now for about 50 years. But I'm pleased to report that I think that the age of breast implants is in decline, because we now have a much better way of augmenting the breast, and that is by using what we call autologous fat transfer, taking fat from the tummy, the hips and the thighs, preparing it, and injecting quite large volumes into the breast, and then making the fat grow. Tissue engineering is now the future of many parts of medicine, including aesthetic surgery, growing organs, growing glands. And breast augmentation over the years has been beset with so many problems. Just go back here. Silicone. So many women have silicone breast implants. What happens? They're, of course, not lifetime devices. They leak, often in as little as 2 years. If you do MRI studies, by 8 years, 40% are leaking. This is what they look like when they leak. Even the new, thick, high cohesive gel implants leak. In my own practice, I have for a long time preferred to use implants which have been filled with saline, salt water filled implant, because I think if they're put under the muscle and inserted properly, you get just as good a result as with silicone. And of course, they have the overwhelming advantage of peace of mind, because if they ever do leak, this one has a tear, it's only salt water. And changing the implant over is like changing a tube in a tire. Implants have many other problems, including capsule contracture, and where scar tissue forms around the implant. And this is from two sides of the same patient. You can see it's starting to form here. It's due to a bacterial contamination of the implant, and then ultimately progresses to this scar, which compresses the implant and causes a very hard breast. So many problems we've had with breast implants. All because women want to have bigger breasts. And it's got a little out of hand, because it used to be that women were happy with a modest B, a C. Now they want double D sizes, and the media, I think, has driven this desire for bigger and bigger implants, which have caused more and more problems. So much of I think we could discuss later, Rabbi, about desire. Desire. People have desire. To what extent should we moderate our desires if something becomes dangerous or unreasonable? And to what extent should we as doctors facilitate a desire if we think it's not really appropriate or not reasonable? And I think most ethical plastic surgeons will recognize this. And there's a condition known as body dysmorphic disorder, where patients will never be satisfied with surgery. and never satisfied with the appearance. And we have to recognize that early and try to dissuade them. But regrettably, there's so many practitioners that most of these patients will find someone who will do the operation for them. Now, recently the Chief Medical Officer, and we have such a person who lives in Canberra and advises mainly about immunisation programs, so on, he issued this fact sheet about silicone implants, and he said, interestingly, that all silicone gel-filled implants are considered high risk. So you would wonder when the Chief Medical Officer says this, why people still use them, why people still have them. Why are they high risk? They've got a limited lifespan. They could be ruptured without you knowing they've ruptured. An MRI can tell you it's ruptured, but it can't predict that it's going to rupture. And this is the bad one. The silicone can migrate often to the lymph glands under the arm, and especially if it's put under the muscle, which is the preferred location, that's where the silicone usually goes. Now, although there's no risk of increased risk of breast cancer, there's now this other terrible dark cloud that exists over breast implants, particularly textured breast implants, a condition called ALCL, or anaplastic large cell lymphoma, which is a type of cancer of that capsule that can form around breast implants. And in Australia, regrettably, we've had 40 cases of ALCL, including 2 deaths from this condition. So it's almost like, there's been a punishment meted out for women who've chosen these implants, and the surgeons by this dark condition coming in. And now I think most women who've got these textured implants will have to have them removed. And my own solution in this situation is to remove them and replace them with the patient's own fat. Now, I'm sorry I can't show you results of fat transfer to the breast, but it does produce a very nice, natural augmentation. Not large. You can usually go up 1 to 2 cup sizes, so it's always size appropriate. But the way it's done, we actually take the fat in a procedure similar to liposuction. The fat is collected in this canister. It is then prepared by washing and multiple filtrations till we have a very pure fat. It's placed in syringes and with a special cannula injected into multiple strips all over the breast. And then after that, we grow the fat in the patient's breasts. Now, where else is fat being used? Well, is this ethical or not? The Brazilian butt lift. Not a procedure that I do, but I see some of my colleagues are, advertising it on the internet, on Google. It's the latest thing now, the Brazilian butt lift. Perhaps the Rebbitzin would be interested. So, as you see, there's some procedures that we might see are completely appropriate, some that we perhaps don't see are so appropriate, but again, to the individual person, they may be appropriate. And of course, we're coming to the end now, but this one of gender reassignment, a major procedure, a major change. And yet now doctors, pediatricians are recognizing gender dysphoria at an early age, before puberty. Indeed, they want a diagnosis before puberty because they can then influence the puberty and prevent girls who really should be boys from developing breasts by appropriate hormone treatment and so on. And of course, gender reassignment is conducted on a regular basis in Melbourne. Actually, Masada Hospital is the place where, and I think pretty well each week, there'd be 1 or 2 gender reassignments performed at Masada Hospital. It's technically very demanding for the surgeon to do this procedure. It can involve multiple operations, and the patients are very carefully screened. The plastic surgeon never takes the responsibility upon himself to do it. The patients have to go through a committee. Indeed, a man who wants to become a woman has to live, I think, for 2 years as a woman in society and function and work before they will be approved to have this operation. And of course, it's not something that you'd ever want to reverse. So then I think this is my final slide. And in conclusion, seeing we're discussing ethics, I'd like to say that I believe I've presented you with the reason behind the choice that most people have to have plastic surgery. And is it, in most cases, it is a personal choice. And we have to respect individual freedoms, perhaps beyond our own prejudices. But it's all governed, of course, by informed consent. And if you look at, I just photographed this today, our own informed consent form. And we advise patients that they must have realistic expectations of the outcome. Surgery may not change your life in the way that you want, desire, expect, or demand. And of course, there are complications. And although in a good surgical practice, complication rate might be as low as 1%, in many practices, a complication rate of 20% is common. So there can be complications, and these can be bleeding, infection, delayed healing, scarring, asymmetries, anesthetic complications. So all of these complications, and when they do strike, they can affect your life in a way that you could never imagine. So once a person is cognizant of all these complications, if they then, through personal choice, exert their individual freedom, and the procedure is reasonable to perform, then I think that we have on record that it's a reasonably ethical thing to do. Thank you very much for your attention, and I'd like to pass on to Rabbi Glassman.
Thank you. Not going to take much time in between speeches, but that was very informative, and we appreciate it. Rabbi Glassman is the Rabbi, the Chief Minister of St. Kilda Hebrew Congregation, and is also the President of the Rabbinical Council of Australia and New Zealand, and we look forward to his comments on the ethics and on how Jewish values play out in cosmetic surgery.
Good evening. Just by way of introduction, Dr. Kaylis was making certain cross-references to myself and Rebbitzin. Just give you a little bit of context. Dr. Kaylis is a long-standing member of my shul. We know each other and have known each other for a long time. So just in case you're wondering why, and he's got a great sense of humor, I have to say. What I would say as well, though, is that Dr. Kaylis is an excellent plastic surgeon, or aesthetic surgeon, should I say it, and in the very, very unlikely, extraordinarily unlikely event that there are complications and issues for some of his future patients who might be in this room, as is referred to earlier, his brother Henry is a very prominent and excellent lawyer who will happily take the case. So I think they sort of bounce off each other just a little bit in that respect. I wanted to talk about the concept of cosmetic surgery or aesthetic surgery from a halachic and Jewish ethical point of view. Now, of course, when I say Jewish ethical, any Jew can have an opinion on what their ethics are or aren't. So I'm obviously drawing on the ethics as defined by the codifiers of Jewish law and by the various rabbis who have dealt with this issue. Predominantly and by and large, there are four distinct issues that have to be addressed or focused on when determining the permissibility or otherwise of cosmetic surgery or specific instances of cosmetic surgery whereby one might be allowed according to certain authorities and another one not allowed. If you look back into the Talmudic era, so you understand the construct of Jewish law and how it is, there's no such thing as contemporary rabbis just sort of waking up and saying, oh, well, there's questions about plastic surgery today which we didn't have some decades ago, so now let's just start putting pen to paper. There is a construct, there is a process of determining Jewish law, and it's based predominantly on precedents. So we look for precedents in the Talmudic era because the rabbis of that era were highly knowledgeable, obviously, much more so than today, and therefore if there are precedents of this particular type of surgery in Talmudic texts, then the rabbis of today can draw on those precedents to be able to make their rulings for those who do seek the rabbi's advice in regard to this. Very little is found in the Talmud on this issue for the simple reason that plastic surgery was not performed all that much back in the day. So one of the earliest, even though there is sort of reference to some cases, it's certainly not explained to the same extent as many other areas of Jewish law. So therefore, the earliest comprehensive analysis of this issue was actually by one of our former chief rabbis of the Commonwealth, of the United Hebrew Congregations of the Commonwealth, Lord Emanuel Jacobowitz. He wrote a fascinating piece on this, and he articulates 4 specific issues that need to be addressed with regard to the permissibility or otherwise of cosmetic surgery. 2 of them are halachic in nature. The other 2 are ethical or philosophical in nature. The 2 halachic issues are, number 1, chavala. Chavala literally means wounding. The notion of inflicting wounds unnecessarily upon others or upon oneself. That's the first issue that he discusses. The second issue he discusses, halachically, is the notion of sakana. Sakana means danger. Every operation carries with it a level of risk. There is no operation that is totally risk-free. The risk might be low, but it exists, and different operations will have different risk factors associated with them. And therefore, the second issue that needs to be incorporated in the decision from a halachic point of view would be sakana. What is the extent of the danger involved? Is there a risk? And so on. The third issue, which is more philosophical, is the question of vanity. Vanity is not considered a particularly virtuous trait in Jewish thinking and Jewish teaching. Every Friday night we gather around the Shabbat table. We sing a beautiful song called Eshet Chayil, the woman of valor. It is a song that is a tribute to the woman of the home. And in it, right towards the end, we sing those beautiful and immutable words, Sheker hachen vehevel hayofi. False, or vanity is false, grace is false, beauty is vain, Isha yirat Hashem hitit halal, a woman in awe or in fear of God, she ought to be praised. In other words, what is the virtue of the Jewish woman, or anyone for that matter, but the focus of the song is, of course, the women in our lives. The ideal virtue is yirat Hashem, fear of heaven, being a good person, having strong morals, having strong values, and so on. Chain and yofi, grace and beauty and all the external stuff, is something that is entirely transient. Every single person, it's transient for every single person, and therefore is something that's not really focused on as what should define our character and who we are. St Kilda Shul, where I work, is fortunate to have many weddings, and one of the beautiful messages that I like to communicate to a couple under the chuppah is the notion that the bride, for about 98 or 99% of the most important ceremony in her life, is standing there with her face covered, completely veiled. And it's true that in less religious circles, like St Kilda Shul, the veil is pretty transparent, but at least symbolically it's there, and in more religious circles, the veil is actually quite opaque. Why would we subject a bride, a wife, standing under the chuppah on the most important day of her life, to cover her face for the entirety of the service until the end of the ceremony, where she finally lifts it and then may kiss the groom? The answer that I try to communicate is that this is a message that the groom is communicating to his bride and wife-to-be, that it is not for her external looks that he is attracted to her, that he is committing his life to her under the chuppah. It is rather for who she is on the inside, not what she is on the outside. So therefore, he veils the face to say that the external stuff, that's not what I'm marrying. I'm marrying you for who you are. So this is a strong theme within Jewish thought, within relationships in particular. The notion of vanity is frowned upon, and therefore the question of cosmetic surgery does raise that in the instance where it is entirely aesthetic. So of course, Dr. Kaylis did distinguish between reconstruction surgery and cosmetic surgery. Reconstruction in halachic literature is by and large unanimously permissible. If a child is born with a physical defect that might impact on his or her upbringing or growing up in school, kids are cruel. That's just the nature of the world in which we live. or if they were involved in an accident, or there's genetic issues, etc., these are obviously far more favorably viewed in terms of halakha. But when it is those other issues where a person, they can get on in life, what percentage of the world's population are model material? Let's be honest, 2-3% maybe. Most people are just regular people, and everyone has their redeeming features and so on and so forth. So in that context, vanity becomes an issue, and that's obviously focused on by the rabbis. And the final one, which Lord Jakobovits looks at, which is really a spiritual and philosophical question, is who are we, and on what basis do we rectify God's handiwork? God created us. This is how we are. This is who we are. If I go to a surgeon, I'm not trying to take away your business now, but if I go to a surgeon and I say, fix me, that implies there's something wrong with me. But who said there's something wrong with me? If God created me like that, it's like the famous expression, your birth is God saying you matter. It's the way God says you matter to me, because otherwise you wouldn't be here. And there's a classic story in the Talmud of a gentleman who was riding a horse in the outskirts of a city, and as he was approaching the city, one of the rabbis of the Talmud saw him. He was the ugliest guy he ever saw. And the rabbi, extraordinarily uncharacteristically, because this was one of the great sages of the Talmud, he must have had a very, very weak moment, went up to that person and actually stated to him that you are the ugliest thing I've ever seen in my life. Could you just imagine that? The person's response was phenomenal. He responded in Hebrew, if that's what you think of me, leich lahauman she'asoni. You go to the craftsman who made me. You're insulting my looks. You're insulting the God that you pray to 3 times a day. So in that context, do we have the right to start changing and fixing and modifying and amending and regulating the way we look if that's the way we are? So all of these questions come into consideration. The halachists tend mainly to focus on the first 2 issues, which are the halachic ones, wounding and sakana, which is the notion of risk or danger. Now, with regard to wounding, most of the discussion does focus on this. Everyone agrees that if A wounds B, A is culpable. That is a crime not only in civil law, but in halacha, in Jewish law. You're not allowed to hurt another person. It's called chavala. There's a whole section in the Talmud called Havchovel, which talks about these laws, and you have to compensate them. And in the Torah, when it says an eye for an eye, and et cetera, it is not referring to literally, responding in kind, and if you accidentally knock out someone's eye, you have to knock out your own. It's monetary compensation. That's the law. So the question then becomes, okay, it's understandable that I am not allowed to inflict a wound on someone else in a violent and degrading way. But what about inflicting a wound on myself? It's my body. I'll do what I want. I'm not touching you. This is my right. We spoke about personal choice and personal freedom. Why can't I just do whatever I want? Individual freedom. So here we find a dispute amongst the sages where some argue that chavala on oneself is not considered a prohibition in Jewish law, but most argue that it is. And the simple reason that harming or wounding oneself is considered restricted according to Jewish law is because it is not our body to begin with. We don't own our bodies. We are custodians. God invests a soul into our body. We are given X number of years throughout our lives to carry out a particular mission. That mission is to serve God in the best way that we possibly can, to make this world a better place. We need a body to do that. The soul without the body cannot light Shabbat candles, it cannot keep kosher, it cannot eat matzah at a Seder night, it cannot fast on Yom Kippur, etc., etc. So we need a body to carry out our mission statement. That's why God gave us a body. Now, if that's the case, what right do we have to inflict a wound upon ourselves? And therefore, it is considered a prohibition. Some argue it is a biblical prohibition, which is one of the heavyweights. Others argue it's only rabbinically prescribed, but nevertheless, it is certainly not allowed in Jewish law. That's the bottom line. So we're not allowed to hurt ourselves. And therefore, if one goes under the knife, in an instance which halakha would not allow, there's actually two things going on over here. There's the object and the subject. There's the doctor's prohibition. The doctor, if he or she is Jewish and they follow halakha, they're not allowed to inflict that wound on someone. And the patient is consenting to it, so therefore, even though they're passively, they're not the one actively inflicting the wound, but nevertheless they are doing it. Okay? So that is the notion of chavala. But once we have established that chavala is a prohibition, that inflicting a wound upon oneself, whether by one's own hand or by consenting for someone else to do that, once we have concluded that that is indeed a prohibition, the next question then becomes, are there any exceptions to that rule? So simply speaking, if I am having problems in my life, people sometimes have problems, they do self-harm. Now that itself is a psychological and emotional problem that has to be dealt with. It would be completely irresponsible for someone who is in sound mind to say, oh, I've had a rough day today, so I'm going to go home and cut myself, or I'm going to do something to myself. That's certainly not allowed, because that is a form of wounding for which there is no actual purpose. Nothing is alleviated. Problems don't get fixed by hurting ourselves. And most importantly, the wound is destructive and violent in nature. That's the type of chavala that the rabbis are talking about, the halachists are talking about when they say it's a no-go zone. If, however, and this is where all the contemporary commentaries weigh in, if, however, this notion of wounding is not an end in itself, but rather a means to a further end, whereby the outcome is to alleviate suffering of some sort, whether it be a medical or physical condition, whether it be a psychological problem, like the boy that we saw who had the ears going out. In a perfect world, kids wouldn't make fun of other kids. But we live in a very, very imperfect world, and unfortunately, children hurt each other with words. That's the reality. Bullying is a massive issue, and fortunately, most schools take it very seriously. But it's the ongoing bullying that is affecting this child psychologically. The ears, it's not a physical condition. There's nothing wrong with that, technically, as we know. But unfortunately, because of that child's subjective experiences in school, they made the family made the decision that he'd bring his ears back. Now, according to Jewish law, would that be permitted? So we're going to go into the specific personalities of who says what, but there is absolutely very, very strong grounds to allow for a green light for that. Because once again, even though the surgeon has to put the child under the knife and make an incision and inflict a wound, the wound, once again, is not the end in itself, but a means to a further end. The wound is there to improve the life of that individual. In this case, to obviate bullying, or what have you. And there may be other situations. A person simply, we saw the cases of the nose and so on and so forth. There are many people who just couldn't care less. They don't care how they look. They're very comfortable and confident in their own skin, and that's it. But there are many others for whom, for whatever reason it might be, are less secure. We have to respect that, because human beings are complex beings. And therefore, there are elements of our own psychology, our own emotional well-being. There are things related to our upbringing, to our background, to a whole raft of different experiences, life experiences, that could simply lead us to a point where we feel subjectively uncomfortable. Now, the fact that our next-door neighbour doesn't feel uncomfortable with that is utterly irrelevant. This is something that is very subjective, and when a person discusses it with his or her rabbi, if they choose to consult a rabbi, the rabbi is going to ask these questions, so it's just like the doctor will. They're going to ask, how does it make you feel? Are there any other ways to alleviate this, etc., etc., etc.? And if it is determined that the most effective way, or possibly the only way, to fix that particular problem is through a surgery, that is not the chavala that the sages referred to when they said it's prohibited, because it's not destructive and it's not violent. It's done for a purpose. It's done as a means to a further end. In 1964, a young woman who was struggling to find her life partner because what she believed was the way she looked, asked or consulted the rabbinate at the time and said, can I have plastic surgery to improve my looks? And I up my chances over there. Because men, as we know, are often superficial beings, and we look only skin deep, so we tell them, cover the bride and look at the inside, but let's be honest, I mean, men are driven and are wired in a certain way in many, many instances. And just in my own experiences, when I try to do some shadchan work, when there's a guy and a girl and they come, you often ask, what are the priorities? Most men, realistically speaking, most guys put looks as a high priority. That's just my experiences. Maybe you can disprove me. And most women that I've experienced, they'd say looks is kind of a bonus. And that's not to say that women aren't, sexual beings and that they don't appreciate good looks. And I know women who say, George Clooney, et cetera, and that always makes me feel good because it means that when my shul makes me get my whites up here, it's not that bad. George also has whites, and the people like him, so there's hope. But on a serious note, most women that I've discussed this issue with would like looks as a bonus, but they'd much prefer a mensch. They'd much prefer someone who's going to treat them nice and treat them with respect, etc. And the looks come and go, whatever it is. It's not as much a driving issue. So this poor young lady felt that the way she looked was inhibiting her ability to find a shidduch, a match. So she asked the rabbinate at the time, and one of the leading American rabbis who I think he was from America, who authored the Sefer Chelkas Yaakov, his name was Rabbi Jacob Bleish, he responded that in this particular situation, the prohibition certainly does not apply because once again, in her subjective experience, she was suffering and she was lonely and she wanted to find someone. And therefore, the rabbi advised her that it would be halachically permissible to undergo the procedure. I don't know if she did or not. I'm just telling you that that's what he ruled. Various others take the same. Has anyone heard of Rav Moshe Feinstein? Rav Moshe Feinstein was the leading posek, the leading halachic decider of his generation back in the 80s, 70s and 80s in the United States. He too ruled in favor of permissibility of this particular practice for these purposes. Interestingly, one of the other leading deciders, Rabbi Eliezer Waldenberg, known as the Tzitz Eliezer, disagrees. And he argues that we don't have a right to change God's handiwork. So as opposed to reconstructionist surgery, when it comes to aesthetic or cosmetic surgery, as long as a person can, just walk around or whatever, and they're not subject to outright ridicule, etc., he would argue that you're not allowed to do it, except in the most extenuating circumstances. And the reason that's particularly interesting is because Rabbi Eliezer Waldenberg was by nature not a particularly strict type of rabbi. The fascinating thing is sometimes you find a consistency. There are certain rabbis who are just naturally more strict and certain rabbis who are naturally more lenient. We've all heard of Hillel and Shammai, the famous Talmudic contemporaries, and the would-be convert came and said to both of them, teach me the whole Torah standing on one foot. So what did Shammai do to respond? Shoves him off with a stick, hits him and shoos him away. And Hillel took the question and, of course, answered with the golden rule, Ma dasani alach lechavrich lo savad, what you don't want done unto you, don't do unto others. That is the entire Torah, and the rest is all commentary. So you see the different approach between Hillel and Shammai in the way they responded to this halachic question. That approach was consistent throughout the vast majority of their rulings. They ruled on dozens or hundreds of different cases, and almost always and consistently Shammai was strict, that was his nature. Hillel was lenient, that was his nature. Very, very rarely did you find the opposite. We find that quite frequently, which is why if you're into the halachic scene, you've got to know which rabbis to ask which questions. You go to this one for questions on Shabbat, and that one on questions on kashrut. Anyway, Rabbi Eliezer Waldenberg was bold to permit, this was a very powerful and very contentious one, he permitted abortion in instances where the child, through the ultrasound or what have you, was diagnosed as a fetus with Down syndrome or other types of genetic problems. So that was a very bold move. I mean, you're talking about matters of life and death. This was the same Rabbi Eliezer Waldenberg who said yes to that, said no to plastic surgery. So he obviously went through the issues and formed his view as it was. He wasn't sort of always ruling one way or the other, but he was a very, very strong and highly, highly respected authority in his time. And even today, many, many people, he's considered within the top 8 halachic authorities of modern history. So we do find that there are varying views. Generally speaking, the majority or many of the contemporary halachic decisors today find a compromise. And what they effectively say is that in important cases where it's really important to that person, which usually is the case. I mean, at the time, if the plastic surgeon is ethical, and most, I would assume, are, they're going to be asking these questions. All right? Most cases are not the Brazilian whatever thing you were talking about over there. Most cases are genuine, serious cases, in which case they've got to pass a certain standard, a certain test. You know, there are rules and regulations in this country, in this state, and so on. So, you know, the fact that someone's already having that conversation with the surgeon is already indicative of that person's reality in their life. So in those instances, the majority of authorities say it's okay, but in the cases where it is pure vanity and everyone can see it's vanity, etc., then that's where the rabbis will probably err to the side of caution and say that is a rule, that is a wounding that is entirely unnecessary. I could argue that Rav Eliezer, who's one of the great Ashkenazi leaders, and Ovadia Yosef, one of the great Sephardi leaders, also followed the lenient ruling, that when there's need, it becomes halachically permissible. With regard to the question of sakana, danger, 100 years ago it was dangerous. Today it's not dangerous. Most cases, we've just heard, in and out on the same day, 3 hours later, already leaving. There is a risk involved in every single procedure, but the risk involved in these types of cosmetic things is very, very low. There's possibly a greater chance of getting into a car accident by simply going on the roads. So therefore, everything has to be taken into context and looked and seen from the appropriate perspective. In essence, therefore, and in conclusion, is plastic surgery permitted according to Jewish law? According to many authorities, it is. That's the bottom line. However, if someone does care to do it according to the Jewish law, just as one has their own doctor, and one has their own accountant, and one has their own whatever, a person should have their own rabbi, at least that they feel comfortable to approach. And if someone does want to get sort of a halachic ruling, go to the rabbi. Most rabbis are very open-minded and are very approachable and are able to understand the issues at hand. So it's not all just books and halakha. The human element is very, very important to this as well. And the rabbi will be asking questions about how do you feel, and how does this make you feel, and that make you, etc. So that's often going to inform the rabbi's decision with regard to this. But certainly from a halachic point of view, there is very, very much leeway for this particular procedure because, as I've said, they are a means to an end. They are not in and of themselves. I want to conclude with a story that I heard from an English rabbi. His name is Rabbi Yossi Chazan. He visited Melbourne some years ago as part of the Yarchei Kala program. You may have seen flyers and billboards for that, and he was giving a series of lectures. And in one of the lectures, he was talking about shidduchim and matches and weddings and all that sort of stuff. And he stated the following story, that a young couple met, started going out, and really liked each other. And when it came time for him to sort of pop the question, he had one major problem. He didn't like her nose. And he didn't say anything to her throughout the entire period that they were dating, because he didn't want to hurt her feelings or whatever, but when it came to that critical moment, he said as much as he tried to get over it psychologically and visually, he just couldn't. It bothered him. So he was in a dilemma. What do? Do you just not communicate that? You know, a famous person once said that someone who is courteous to their wife will be economic with the truth, right? In other words, you don't have to say everything. Honey, how do I look in this? You look wonderful, you look beautiful, and then you can cop it the other way. Well, you didn't even look, you're just saying that. But anyway, we won't talk about the whole usual dialogues that go on. But it bothered him. So he decided he's just going to fess up and say it as it is. And he told her, this is Rabbi Chazan telling the story, he said to her, look, honey, I really, really like you. I really like you, and I want you to be my wife. But there's this one problem, your nose, it bothers me. Now, I know some people are going like this. I want to tell you something. I see that argument. Like, if that's what bothers you, then get out of here, you're not good enough for her. But I can also see the flip side of saying at least he's honest. You know, a woman might want someone who's honest and able to communicate their feelings and so on and so forth. Everyone can decide for themselves that particular, the ethics of that. But he told her that. And he said to her, I want to marry you, but on condition that you get a nose job. She agreed. She agreed. They got married, and within a matter of days or weeks or whatever, she fell pregnant straight away. Okay? So obviously, you don't go under the knife straight away when you're pregnant, certainly not back then when it happened. So they discussed it, and she said, they decided, look, we'll wait till the baby's born and so on, and then we'll have the procedure after that. Fine. So they waited, the baby was born, and within a very short time span, she fell pregnant again. And they said, look, we're not going under the knife, etc. She was thinking to herself this. They didn't actually discuss it, whatever. And then the same thing happened a third time. Yeah. And so this went on for a few years. Finally, I think they discovered contraceptive. And they decided to take a break. And it was about 10 years after they had gotten married. And she went to him. They hadn't discussed it in ages. And she went to him and said, honey, I'm finally ready. He said, ready for what? She said, I'm ready for the nose job. You remember when we were dating and you said, you marry only if I get in a... And he says, nose schmoes, honey, you look beautiful. So in other words, the moral of the story is that he was able to get over his issues, because when one falls in love and develops a healthy relationship, then all of those superficialities that bothered someone in the beginning become completely irrelevant and secondary to the person. The idea of veiling the face. So it's about who you are, not what you are, etc. If only, and here's the hope and the blessing and the wish, the way we're able to overlook other people's imperfections when we grow to love them, we would be able to overlook our own imperfections when we grow to love ourselves. So I'm not necessarily advocating against cosmetic or plastic surgery. I'm just saying that we should be very comfortable in our skin. This is the way God created us. And if anyone's got an issue, as that man famously said to the great sage in the Talmud, Leich laha'uman sha'asuni. Go to the craftsman who made me, because I think he knows well what he's doing. Thank you.
Thank you for that informative and fascinating presentation. And I will say that both speakers, both in terms of the content and in terms of the humor and the delivery, have kept us very engaged the whole time. We'll have time for several questions.
A good job, but I like to represent a 12-year-old or 13, 14, 15 who has a number of symptoms of Down syndrome. Now, they're minors, they can't make decisions, the parents struggle to make a decision, and they're teased, they look in the mirror and keep saying, oh, I do have Down syndrome, I do have, and I know of a case. How ethical? So, to help self-acceptance, I don't like the word self-esteem, self-acceptance, it seems that an operation may be justified. But, ethically, is this girl doing it for herself or to tell society, look, I'm actually not different. I'll have an operation, you'll see me just as others look. So the issue is actually deeper than just helping the individual cope and survive schooling, and perhaps later even shidduchim process. But the ethical issue is let's say my son, they're all married now, but had they not been married, would meet a lovely girl and then end up who had the operation, and then end up discovering that actually there is the chromosome disorder. I'd love to hear your opinion about it. Both of you. Do you have cases, Dr. Kalus?
If I may first. So it is not uncommon to operate on children with Down syndrome. One of my predecessors, Dr. Leo Rosner, operated on maybe 10 or 20 such cases, and one operation he did, for example, was just to reduce the size of their tongue, because often the tongue was excessively large, it made them drool, and it was a disability for them. The question is, who makes the request? Should we respond to a request by the parent, or should we wait for the child to make the request? If they know that if they are suffering, and if surgery can be performed, and I take completely what Rabbi Glassman says, we are cutting and that we are complications, we have to understand these things. And one of the tenets in surgery is expressed in Latin as primum non nocere, first do no harm. And we always think of that. How can we do this procedure with minimal harm? What's the risk-benefit ratio here? And I think for some Downs children, I think it's appropriate to help them to cope with their disability. It is a disability. How do we explain it halachically? Does God sometimes get it wrong? Humans are complex beings. Rabbis are complex beings. We'll have different rulings from different rabbis for different emotional reasons. They've got their own background and so on. But I'd like to address one other issue now, and that is something which our youngest daughter Eliezer wrote a paper on recently, and it's called the attractiveness bias. And it's well known that in the workplace that attractive people are more likely to succeed and more likely to have higher paid positions and do better. And she proved it. She looked at a number, and it's been proven in a number of studies, looking at people, showing photographs and attractiveness being graded, and then looking at the people. And she actually followed some people at my own practice and some other people, and other surgeons, our colleagues' practice, who'd had facial plastic surgery, and followed them. And she found that the people who had surgery performed better in the workplace. They went on to get a promotion or a better job, a higher salary. She actually proved it. And when it was published by the management department at Melbourne University, they put a very interesting twist on it. They said that employers should be aware of this attractiveness bias and should be aware that in some cases they're employing the wrong person, because the right person for the job may not be the most attractive person. They may be the person with better computer skills, better mathematical skills, better English skills. And although there may be some roles where attractiveness is required, such as being the wife of a rabbi, in front of a business, there may be some situations where attractiveness is important for a company. In many, many roles, the attractiveness bias can lead to a company underperforming because they're not employing the right person. But it does exist in our society, probably because we are imperfect human beings, and we need to be aware of our biases and act accordingly.
Was the sample of subjects balanced for gender, or were the ones tested women and the employers men? Anyhow, it's just...
I just wanted to touch on the one difficult question. I think you alluded it to a doctor when you said, does God sometimes get it wrong when children in particular are born with certain conditions and so on. I think that there are this is a very, very emotive issue for many, many people, and I accept that. So I'm treading very carefully, but I think that there are two planes of existence in which the world operates. There's a higher plane, and then there's the mundane, lower physical plane in which we sort of operate. On a higher plane, by definition, one cannot say God got anything wrong, because he's the master designer, and there's a blueprint for creation, and there's purpose for everything, etc. The problem is that the perfection that exists at that plane is super rational. It's something that transcends the capacity of human beings to understand, because we, in this physical plane that we're living, we live in a world in which everything has to be measured by certain factors, by certain measurements, which are all sort of man-made. So we decide what is considered good or bad or positive or negative, etc., based on our own experiences, on our own personal experiences, etc. So therefore, you just mentioned attractiveness. Who's to decide what's attractive or not? Society has decided that. And society is then inculcating those beliefs and positions in the minds of young kids as soon as they get hold of their little iPad, their little phones, their screens. And if they don't see it in the screens, they see it on the billboards when they're driving to school or what have you, or being driven to school. So in our world, we see things in a way which is measured by ability to succeed or otherwise, and so on. An example, but in reality, on a higher plane and a higher sense, from God's perspective, he doesn't see imperfection because he designed it as such. It was like that case of the guy on the donkey and what he said back to the rabbi. So a classic example of this is where someone came, everyone knows that the Lubavitcher Rebbe of blessed memory, Rabbi Schneerson, Menachem Mendel Schneerson, he used to stand on Sunday mornings and give dollars out to people to distribute to charity. And in that time, some people would ask for blessings or what have you. There's a fascinating encounter that was caught on video. The father of a child who was severely autistic, and the father came, he had two kids, one who was not autistic and the other one who was. The autistic child stayed home. And he brought his other son. And in the Rebbe's presence, as he was receiving his dollar, he said to the Rebbe, I have two children. This is my one son. My other son is at home. He is severely autistic, so I didn't bring him because he has difficulty interacting with people around him. And the Rebbe quite famously responded and said to him, with regard to your son who's at home, he may have difficulty communicating and interacting with people around him, but his communication with God is higher than yours and mine. In other words, than that of everyone else. So he saw it from a completely different perspective, which people living in a world in which we gauge everything by our successes or otherwise, which are imposed by society, may not be able to appreciate. That's what a leader does. That's what a spiritual giant is able to do. So I guess I just wanted to refer to that particular point and to say that there are two planes of existence. The reality is that most of us, I'll speak for myself, live in this existence, and we only define what's good, bad, or otherwise by what the mind tells us and what our heart tells us, and that's predominantly societal, much more societal than an objective reality, and that's just the fact.
Could I maybe ask the rabbi a question? How do you explain the Brit Milah if God made us perfect?
All right, we're going to be here till tomorrow morning now. Did you know that there's a famous passage from the Talmud which says, Kimu ha'avos es kol ha'torah ad shelo nitna. The forefathers, Abraham, Isaac, and Jacob, and the matriarchs, kept the entire Torah before it was given. The Torah wasn't given till Moses' time in the year 2448. They lived 1,500 years before that, and they kept everything. It says even the Erev Tavshilin, even that rabbinic injunction that you've got to prepare something on Yom Tov before Shabbat, etc., they fulfilled everything. If that's the case, why did Abraham wait till he was 99 before the snip, or till he was 100 before the snip? And various answers are given. And one answer that's given is that he didn't want to inflict self-harm. And it wasn't until God commanded him, when he actually had a mitzvah to do it, that's when it overruled the prohibition of self-harm. So long as he wasn't formally commanded to do the Brit Milah, he felt he wasn't allowed to, because it was inflicting a wound upon himself for no reason. And then, of course, once he got the commandment, off he went and he did a sterling job. I think the Bible says that everything came off smoothly. Okay, sorry. So that's what we learn about Abraham in the first Brit Milah. The notion of the Brit Milah is God's way of telling us that he put us into an imperfect world, and our role is to perfect it. And we start off with ourselves. So there is an element of imperfection that is designed as such, so that it inculcates into our mind the notion that we have to rectify things, and that's where the Brit Milah comes in. Otherwise, he just would have created us circumcised. So, and there's many other explanations to the Brit Milah, Kabbalistically and spiritually and so on and so forth, but that's one of the ideas, since we were talking about the difference between perfection and imperfection.
So
is it a halachic question or a philosophical?
halachic. So you admit God did create us imperfectly.
In this area. Only men. Women are perfect. All women are perfect, because he's recording it and the Reverton's going to see it at one point. Yeah.
Okay. On that humorous note, I'd like to thank both of you. And this is just a small token of our appreciation for Dr. Kaylis. Thanks a lot. Hope you enjoy. And for Rabbi Glassman, thank you. I imagine the presenters will be here another couple minutes if anyone has a final question, but thank you for your attendance and participation. Next week, we will be discussing animal experimentation or exploitation. Can animals be used to benefit the lives of humans? That's with Rabbi James Kennard. There'll also be a video presentation there, which will be from a technological and scientific perspective. And then the following Tuesday, Choosing Your Baby, the Science and Ethics of Gene Selection. We've got a lot of other programs. You can look in the front. Thank you, thank you, thank you.